Hello, everyone. So there are some misunderstandings about psychological trauma that I want to clarify. Most people, especially those who haven't studied a mental health profession, they often think that trauma is about what happened to you, like a rape or a car accident or an earthquake. But trauma is actually more about how the body and brain and mind register what happened to you. So an earthquake may not actually be traumatic, but the way that someone looked at you, or like the last 5 minutes of a job interview, or some social interaction that left you feeling very troubled can actually be more traumatic. And what do I actually mean by trauma? People often confuse it. Trauma means any, especially that would warrant a PTSD diagnosis, any past event that still creates significant harm in the present, at least 1 month after it happened. When I do EMDR therapy, trauma work usually focuses on the components of the traumatic memory, such as negative beliefs. I'm not good enough. Um, I should have done something. I'm a bad person. I'm not in control. The emotions that are stored from the encoded trauma memory, such as fear, sadness, shame, guilt, anger, and the body sensations that were encoded as well during the traumatic event, tension in your throat, in your forehead, in your chest, and also the audio and visual components. So we're actually in trauma therapy, we're actually targeting the residue of the traumatic event. And we can also think of physical wounds as an example. Like the brain and body usually heal themselves, right? Like when you get a paper cut, when you catch a cold, the brain and body usually know what to do to help you heal, right? But psychological trauma and PTSD, for simplicity for this video, is kind of like when the body doesn't know how to heal itself. And if we think of a physical wound, if there's a big fat splinter in your body, or like in your hand, the skin can't actually heal until we take it out, right? The body won't know how, won't be able to discharge the splinter by itself. It may create pus and it may get very, very swollen, but it won't actually discharge the splinter by itself. So that's why we need medical attention. The same with emotional wounds. Emotional wounds happen when the brain and body's adaptive healing mechanism, or the AIP and EMDR, the adaptive information processing paradigm, fails, and the memory becomes encoded traumatically and maladaptively, um, without access to all the things that you know that are good about you, all of your strengths, your capacity for calm and confidence. So we can think of emotional trauma um, as a wound. Trauma just means wound, and that's what we target in EMDR therapy: the beliefs, the body sensations, the emotions, the images, and the sounds, and any other components that were encoded during the time of the memory. I hope this helps clarify things for you. Take care. Talk to you soon.